Hi everybody, Rad Mom back with you because nothing is going to stop me. This shit is way too important. Tonight we're trying something a little different. Got you on the phone. Hope the audio is okay. You can hear all the crickets and the bugs and stuff. But welcome back to the garden. Tonight, instead of responding to anybody directly, I'm going to be looking at some stuff that I think really shed some interesting light on some of the darker patterns that we're really starting to obviously see. So, like my video because I need the encouragement, and subscribe to the channel for more feminism from a materialist perspective. And yeah, I got some fun stuff for you. I did a little research because I got to thinking. My husband struggles with his weight. A lot of us do, right? But he has for a long time. And he said that he had read something about a fella who had gotten like a fecal transplant, a gut microbiome type stuff, and had lost a bunch of weight because his metabolism became a whole lot more efficient. And I said, yeah, it's funny. I remember reading stuff about that like 20 years ago. I know it was almost 20 years ago because I knew a girl who had IBS. And I thought of her because that was what they were talking about it as, a treatment for, among other things. And then I read even years after that somebody had even developed a pill. And so now I found myself in the third decade of the 21st century looking at my husband and going, why? I don't know why this isn't a treatment for this. I don't know why this isn't everywhere. I've seen so much different evidence, so many different people studying this kind of thing. And then now we're hearing here and there's chatter about how you have a second brain in your gut and how incredibly important it is, not just for your metabolism, but for your mental clarity, your immune system, all this important stuff. And then I remembered that I don't think the medical establishment actually wants to heal people. And I hate to say that. My grandmother was a nurse. I'm a trained nurse aide myself. My dad was diabetic in the 60s as a teenager. If not for modern medicine, I literally wouldn't be here. So it pains me to say this, but it occurred to me, because I'm me, and I think about this shit way too much, I guess, that trans medical treatment is a really perfect example of this. So let's take a look at what I found. It doesn't matter if the port is broken, if I'm just looking at some pictures. This is from the Journal of Pediatric Nursing from 2012, so 10 years ago. Natal gender is assigned based on chromosomes, sex organs, sex hormones, and external genital anatomy. Adolescent pubertal changes bring exploration of gender as well as a budding sexuality. Persons with a long-standing incongruency, which is a hyphenated word, congruency. Excuse me. Incongruency. I thought that was one word. What century is this? Anyway, between natal gender and the identified gender are often called transgender. Gender nonconforming children challenge parents, healthcare providers, and society due to issues and needs that do not fit traditional dichotomous views of gender and sex. So, did you catch that? We just used the word transgender and the term gender nonconforming interchangeably. And this is the intro. Pediatric nurses may be key healthcare providers as parents question and seek guidance. School nurses, counselors, social service providers, and psychiatric nurses should also have a familiarity with features of gender nonconformity for early identification. Why? Why, you ask? Well, let's roll on and find out. Support services. Yeah. This is supportive like Stalin was a socialist. Right. I don't buy it. That's ridiculous. It's like they're affirmative care. Right? Which means enabling and mutilating. Many gender non-conforming children can find the words to describe their experience, own paradigms, and feelings. when in a safe, supportive setting. You know, the subtext, what's implied there, why wouldn't they be in a safe and supportive setting? For others, it may take time. Establishing a trusting relationship. To speak in more detail about those taboo thoughts and feelings. The word taboo is in quotes because I'm sure that's a word that children are using. Many parents express a concern or need to know if their child is transgender. Yeah! That's kind of an important thing, whether you subscribe to such notions or not. That is the kind of thing any parent would obviously want and need to know to properly parent their child. What the fuck are you implying? And as advice for these professionals who it says don't need to be experts, you just need to know where to send them, okay? Key components of care of gender non-conforming patients, by which they mean transgender, because they treat them as one and the same all the way through this, are to evaluate, teach, treat, support, and refer. It is important to assess and support the patient's and family's state of acceptance. Why? Why can't we question any of it? Why can't we question what? This is for nurses. What the fuck kind of, this is not even clinical sounding language. Affirm. Like, you can't just use a synonym for the word agree to sound fancy. Oh my God. So gross. Nurses do not need to be experts in gender identity issues, but need to be familiar with support services and referral resources that are key to successful care. What do you suppose successful care means? Healthcare and therapeutic options for gender nonconforming children. Anticipatory guidance. I feel like that's redundant. If you're guiding someone, you should probably be trying to anticipate what their needs are going to be, because otherwise you're going to be a terrible guide. Mental health support and early identification can discontinue the development of secondary sexual characteristics in the wrong puberty. Like, wow, that escalated quickly, didn't it? Holy shit. That's just assumed to be the goal here. Scary. Use of gonadotropin releasing hormone agonists. Like, seriously, straight to hormones. It is important to stress to parents that GnRH analogs are completely reversible. How the fuck is lost time for brain development reversible? Because if you don't have the hormones, then your body's not developing and you're just kind of idling there. Like, you don't get that time back. If you never go through puberty, you can become legally an adult without becoming physically an adult, which is some messed up shit. Puberty blockers are typically used at the start of puberty, Tanner 2. Tanner stage 2 is 9 to 11-year-olds. Tweens. And they went right to it. It also gives them time for the development of successful social skills, to move through adolescence in their asserted gender. Why in the fuck can't they use that time to develop social skills to move through the world as who they are? Create a safe and healthy transition plan. There's been almost no mention. Mental health support is what we got. No exploration of where these ideas and feelings come from. Why, this child, A, is unhappy if they're unhappy. B, is acting funny if they're acting funny. And C, why the fuck being gender non-conforming is something that, needs treatment. They did say that it is, associated with lower self-esteem and higher risk of suicidal ideation and social isolation. And it's like, well, yeah, because society is a dick. Maybe we could try and do something about that. Just leave the poor weird kids alone. But additionally, it says here that they might possibly avoid multiple future cosmetic surgeries. That's one of the reasons the hormones are so important, because we wouldn't want to have to do facial feminization surgery on some guy's big jaw. And the worst part about all of this, and the reason that it leads me to the inescapable conclusion, like, help me here, help me, y'all. I hate this. But the reason that I have to come to the conclusion that they don't actually want to heal these kids, they want to turn them into medical patients, is because I've actually been at this party for a really long time. Was reading about this shit in books, paper, back when it was called cross-sex ideation. It was a long time ago. And to be fair, the book probably wasn't brand new when I had it, but I've known for a long time that 80 to 90% of children with cross-sex ideation end up growing up to be totally fine with their physical body, and a lot of them end up being gay. They have known this for way longer than I have. They've known this for decades. And yet, they give us this shit. Why? Follow-up data on the largest sample to date of boys clinic referred for gender dysphoria, and there were 139 of them. In childhood, the boys were assessed at a mean age of 7.49 years, at a mean year of 1989, and followed up at a mean age of 20.58 years, at a mean year of 2002. In childhood, 88 of the boys met the DSM-3, 3R, or 4 criteria for gender identity disorder. When something is called a disorder, mainly that means that it disorders your life, that it fucks with you. If it fucks with you to the level that you really just kind of can't get past it, then you might have a disorder. The remaining 51 boys were sub-threshold for the criteria. At follow-up in 2002, participants were classified as either persisters or desisters. Sexual orientation was ascertained for both fantasy and behavior, and then dichotomized as either biphilic androphilic or gynophilic. Dudes in both or women. Of the participants, 12.2% were classified as persisters. That's really the information that I was looking for. 139 boys followed over 13 years. 12% of them at the age of 20 were still trans. 87.8% were desisters. 80 to 90% get better on our own. Not that help wouldn't be appreciated, but whatever kind of fucking mental health support it is that they're offering is not. No. Because, and they say that, oh, well, the ones that get treatment are more likely to remain trans. It's like, what the fuck does that prove? Persisting in doing something in a supportive environment does not prove anything. Sexual orientation data were available for 129 of the 139 boys at age 20. 63.6% of them were either gay or bi at 20. 33% were straight. And this is interesting. 3.1% reported no sexual fantasies, and 25.9% of these 129 20-year-old boys reported no sexual behaviors. Does that sound healthy to you? Does that sound like they might be happy to you? That's weird. That's weird. But only 12% of them were still trans at 20. There is treatment for this. It's cheap. It's non-invasive. It's drug-free. Doesn't have to be, I guess, but it can be. And instead, that article quotes the WPATH guidelines. When we have proven effective, like not even treatment, like literally for most of them, all you have to do is wait. And yet we're getting nurses being told that it's so important to affirm and refer. This is bullshit. And please tell me what in the fuck this points to other than an absolute corruption of our medical system. I hate it. I hate it. But I really appreciate you digging through it with me because these things are so important. Again, that was from 10 years ago. That was the Journal of Pediatric Nursing. Okay? It's the handbook, literally, for kids nurses from 10 years ago, just completely equating gender non-conforming and transgender, using them interchangeably. Okay, so that's, I guess, where they get the idea that if you show interest in boy stuff, you must really be a boy. From their medical literature. Despite the fact that we have mountains of evidence that disproves everything that thing says. And they go right to hormones. Tanner stage 2. Those are 3rd graders. At the most 5th graders. Who are just not going to get to grow up. Because they're weird. Man, fuck those people. God damn it. Like the video if you found this informative or enjoyed watching me rage against it. And, you know, stay tuned for more stuff because I'm not giving up. I'm going to get that computer to heal whether it likes it or not. And we are going to drag feminism kicking and screaming back to the real world whether it likes it or not. I have been Rad Mom. Subscribe to the channel for more feminism from a materialist perspective. And I will see y'all next time. Bye.